As GPs and healthcare professionals, you know the importance of regular physical health checks for your patients. But for people with a severe mental illness, the life expectancy of someone with SMI can be up to 15 to 20 years lower than the general population. The Physical Health and Severe Mental Illness Report, released by Mental Health Together in January 2021, looked at the barriers that people with an SMI experience in relation to their physical health, with a focus on experiences relating to annual physical health checks. The top 3 barriers that were identified were 1. A lack of confidence, 2. A lack of motivation, 3. Concerns over side effects of medication. Other factors included a lack of awareness that they were entitled to an annual physical health check, the need for better and more tailored communication between practice and patient, lack of inclusion of carers in the communication with the patient, confusion over what a physical health check entailed. We spoke to several people with an SMI and some carers too. We found that their experience of the annual physical health check was quite mixed. Here are some of their insights.
The thing is, my mental health can be so overwhelming that some days I'd rather walk around with a broken arm before contacting the GP.
Having to book a same-day appointment at 8:30 in the morning makes it impossible. Because of my medication, I don't wake up early enough.
Well, I get a letter once a year, and to be honest, I find the physical health check all very straightforward. It's a good opportunity for my doctor to check in with me and vice versa.
My mental health will always take priority over my physical health, so I end up neglecting my physical health.
I think it would be good if the carer was invited to the health check. If the family member agrees, of course. It would allow greater understanding on how to achieve shared goals, for example.
My son is unable to open letters. Voices tell him not to. But he's very responsive to text messages. But his medical team constantly send him letters, which results in missed appointments and frustration.
As these quotes illustrate, patients' experiences are varied, and there are clearly many complex factors that hinder the uptake of annual physical health checks. However, it is important that we are always looking to improve the patient experience. From the findings of the Mental Health Together report, several recommendations were made, which we've shared for your consideration. Every practice would have an SMI register. Maintaining this register will ensure that the patient will be invited for their annual physical health check. It will also ensure that the people on it are appropriate and consent to the checks. Working with SMI patients, a recommended design of the annual physical health check invitation letter is available from the Mental Health Together report. Mental health training for practice staff. Health Education Derbyshire have SMI training available on their website now, with further classes being added regularly. The Rethink Mental Illness website has a physical health check tool that can be recommended to the patient as a valuable resource to support them to manage their physical health alongside their mental health. The importance of making every contact count. GPs and practice staff may well interact with SMI patients for a variety of reasons. These represent opportunities to talk to them about physical health and what is available to them. A follow-up call to provide patients with their test results could help ease anxiety and make them feel the physical health check was worthwhile. Include the discussion around medication side effects. Consider longer appointments with a GP to discuss medication side effects. Awareness of what interventions may be available to support with side effects, including social prescribing support from the practice and services detailed on the Derbyshire Emotional Health and Wellbeing website. Providing a holistic and culturally sensitive approach. Consider each patient's individual needs and work together with colleagues across the system to make reasonable adjustments in order to facilitate care. Ensuring a smooth transition from secondary to primary care. Work is ongoing to improve communication, data and information sharing for these patients who can move between primary to secondary care and back again depending on the nature of their mental health illness. In Derby and Derbyshire, there are several projects and pilots underway which will look at making the most of the staff and services we currently provide and, where necessary, making improvements or developing new approaches. For example, the mental health practitioner roles, OURS scheme, are being recruited to provide PCNs with support for patients with a wide range of mental health illness and conditions. From the findings of the Mental Health Together report and the SMI patients and carers that we spoke to, both healthcare professionals and patients understand the importance of managing physical health alongside mental health. By implementing these recommendations and sharing best practice, we can work together to improve the service we offer the SMI population in Derbyshire around physical health checks, and through improved communication and a fresh approach, increase the number of SMI physical health checks throughout Derbyshire.